be recorded. This conference will now be recorded.
Sir, fourth mark, have you discussed, sir? Fourth mark?
No, not yet.
Okay, sir, then
Shall
we'll
I start
continue
with
with
fourth
fourth.
one? Okay.
Yeah, yes.
2, 3 we completed, right?
Sir?
Up to 3 marks we completed the discussion.
Yes. Up to 3 completed.
Mohan, I have one in mock 3 only one question. Mock 3 98 question. Can you just confirm?
At the end I will show you, Anupama.
Okay, fine.
First we will go with mark 4.
Okay, fine.
One to 10. 1 to 10.
Sir, eighth one, sorry, eighth one B for Bombay will be answered, no?
About the tympanic membrane, it separates the external ear from the middle ear. B is the answer.
Okay, in key A is given, sir. So just for confirmation, I'm asking.
No. B is the answer.
In key,
correct that.
Okay.
Next, up to 10. Up to 10. Then up to 20. To 20. 20.
Sir, 14th. Sir, 14th where will we find the answer, sir? 14th.
It's an general question, Vishnu. Global package for endoscopic procedures without an incision. How many days? 10 days or 90 days?
In key it is 000 mentioned, sir. 000. C.
Okay. That means 0 days.
Okay.
Next, up to 20. Up to 20. Up to 25. Fourth mark paper up to 25. Which statement is true regarding the instructions for use of the CPT codebook? Use an unlisted code when a procedure is modified. Parenthetical instruction defines each code listed in the book. Select the name of the procedure or service that mostly closely approximates the procedure or service performed. Select the name of the procedure that accurately identifies the service performed. D is the answer. D is the answer, Gita Kumari. Name of the procedure that accurately identifies the service performed.
Okay. In key C is mentioned, sir.
No. D is the answer.
Okay.
15th one, D is the answer. Correct. Wherever your answer and the key answer is different, you can ask me that question. I will show you. Next. (16 to 20). 16 to 20. 16th one. See, what is the doubt here? This is an complication. First we need to code complication code. Followed by, here it is septic shock. First we need to code sepsis followed by septic shock. Blindly rule out the option C. Option D. Option C, option D. The remaining answers are A or B. Who asked me this question? This is a rule. B is the answer. B is the answer, everyone.
C is given
Understood?
in key. More.
Which one? Which one?
For 16 only, no?
A, B is the answer, right? B for Bombay. Which option is given in the key paper?
D.
B
for
for
Delhi.
Bombay. No. B for Bombay. 16th one, B for Bombay. First, we need to code sepsis followed by severe sepsis with septic shock. 16th question, B for Bombay. Up to 20.
17th question. Sir, in 17th question, once explain this case, sir. 17th question.
Okay. Option A, option C wrong, option D wrong, only option A. Why?
Sir,
because
how it will be code, sir?
hypertensive heart disease, only we need to code I11.9. If you go there, the instructional note is there, it includes I51 category. Okay, what is your option in the key paper?
A, sir, A.
A is the correct answer.
Okay, sir.
Okay, 18th question. The person is coming for chemotherapy. For what? Metastatic carcinoma of liver, secondary to the cancer of male. But what is the reason for admission? Chemotherapy. If the reason for admission is chemotherapy, sequence first chemotherapy. Then on which side they are performing the treatment? Primary side or secondary side? Secondary to. That means liver. A is the answer. Which answer is given in that one? Geeta Kumar, 18th one. What is your answer in the key paper? A is the correct answer. Next, up to 20, any doubts? Up to 20, any doubts? Up to 25? Up to 25? That billing questions, memorize the questions, the answers. Up to 30, 30. Up to 30, 30. 35. You can drop your question numbers, everyone, so that at that question I will, whatever your doubts in the total paper, you can drop by each one name. For example, Geeta Kumari, 19, 20, 26, like that. You can drop your question numbers. Up to 35. Up to 35. Up to 35. Up to 40. Question number? Up to 40. 35. 30. Sunil, 30. Sunil, here you can see where is the patient located. Discharge pneumococcal. She spends 40 minutes at the bedside. See, discharge from hospital and admits to SNF on the same day, Sunil. Discharge from hospital, admits to SNF on the same day. We need to code two codes. One code for discharge, one code for SNF admission. What is how much time spent by the physician at the time of discharge? 45 minutes. How much time? 45 minutes. Then D is the answer. 30, D is the answer. Is that clear, Sunil? Discharge from hospital and admits to SNF on the same day. Okay? Is that clear, Sunil?
Sir, దీనికి అడిషనల్ కోడ్ చేయొచ్చా? 45 మినిట్స్ అన్నారు కదా.
ఇంకా డిశ్చార్జ్ కోడ్ దేని మీద బేస్ అయి ఉంటుంది? టైం మీద కదా బేస్ అయ్యండి. గ్రేటర్ దాన్ 30 మినిట్స్ 99239 వస్తుంది కదా.
ఓకే
ఓకే, ఇంకెంత టైం అయినా ఉంది 239 వస్తుంది. Yes, Vishnu, what's your question number 35?
Yes, sir. 35.
What is the appropriate code for a patient who had regional block? Anesthesia provided for carpal tunnel surgery. Regional block, that means anesthesia. Carpal tunnel, that means median nerve. 01810 or 01820. What is your answer?
1810, but in code description, carpal tunnel is not mentioned, sir. So I'm confused.
Carpal tunnel. Can you read the code description? Read the code description.
Anesthesia for all procedures on nerves, muscles, tendons, fascia and bursa, forearm, wrist and hand.
Nerves. Regional block. Not performed to bone. It performed to nerves. Carpal. Where it is present? Wrist. Understood?
Okay, sir.
Like that you need to understood. Carpal. Wrist. If you see 01820, can you read the code description 01820?
Anesthesia for all closed procedures on radius ulna of wrist and hand bones.
Any surgeries performing on this one? No, right? This
No,
is
sir.
regional block. That means no block. 01810. Important code. If it is surgery, then it is 64721. Keep in mind. If it is surgery code, it is 64721. They are asking here anesthesia, then it is 01810.
Okay.
What is the option given? D only, right?
Yes, sir. 01810.
The procedure is 64721.
Okay.
64721, carpal tunnel surgery. Next, up to 40. Up to 40. Text your question numbers up to 40. Anyone is having doubt? Up to 40. Up to 40. Up to 45. Up to 45. Forty-three. See, that one C is the correct answer. 43 C is the correct answer. Make it as correction. Understood, Soumya? That is reagent strip he used, blood strip. 43 C is the correct answer. No issues. Up to 45, text your question numbers so that it will be easy for me to see. 45. Up to 50, 50. Up to 50, 50. Up to 42, Geeta Kumari. See, management, the I said the rule there, we can use the code up to maximum 7. How many? Maximum 7. Then here only 7 is, if greater than 7, then at that time you need to report into 2 times. But maximum up to 7 treatments, we will use the code 77427. 77427.
Okay, sir.
Up to 45, up to 50, 50, up to 50, 50, up to 50, 50, up to 50, 50. Anyone is having doubt? 4th mark paper up to 50? No. 50 to 55. Up to 55. Up to 55. Up to 60. 60. 60. Up to 60. 60. Vishnu, no doubts? Up to 60. Vishnu, no doubts up to 60?
Sir, 56. Sir.
56.
Yes.
See, here what they are doing, they are preparing and transferring. It is in directly the code 15610 or 15572. Can you read the code description? To where they are sending forehead.
Sir, but body part is missing, sir. Once again,
Forehead. Forehead. Now, can you see 15610 code description? Can you read that?
Sir, 15610. Delay of flap or resectioning of flap.
No, no need to read. 15572.
15572. Formation of direct or tuber pencil with or without transfer, scalp, arm. Sorry.
Scalp.
15572. Okay. Forehead, cheeks, chin, mouth, neck, axilla, genitalia, hands or feet.
Then this is the answer.
But
yes, sir, I coded this only. I coded this only, sir.
But what is the answer given?
In key C is given, sir.
Okay. D is the answer. Make it as correction. D is the answer.
Yes, sir. Body part is missing, sir. So I asked.
Okay. D is.
No. See, Mohan, in this flap is from the arm and legs, so it should be 15572D. Actually, the pedicle flap is taken from arm and transferred to forehead.
What is the code description? 15574.
Formation of pedicle from without transfer, and that is the forehead is given.
15572.
It is for scalp, arms, or legs.
Okay, I will see.
See once na.
This 7-4 is the correct one. Forehead. Okay. B is the correct answer. B is the correct answer. How you coded D is the correct answer, Vishnu? Body part is different. There's scalp, arm, legs. If you see 15574, forehead is there or not?
Sir, B for Bombay is coded, sir.
B for Bombay is the correct answer.
Yes, I coded B for Bombay.
Okay. Up to 60. 60, 60. 60, up to 60, 60. Up to 60, 60. 60 to 70. You can drop me your question numbers if you are having doubt. 60 to 70.
Sir, in 62 question, it was done bilaterally, sir. But why modifier 50 is not used?
If you see 63047, description.
Yes, sir. Laminectomy, facetectomy, and foraminotomy. Unilateral, bilateral, with decompression of spinal cord, cauda equina or nerve root, single vertebral segment, lumbar.
63030.
Laminotomy with decompression of nerve roots, including partial fascectomy, foraminotomy, excision of herniated intervertebral disc, one interspace, lumbar.
If you read the code description 63047, unilateral or bilateral is a part of the code description or not?
Yes, sir.
If unilateral or bilateral is a part of the code description, do we use again 50 modifier separately?
Actually, I have confusion, sir, here.
See, when we can use by 50 modifier, if a procedure performed on the opposite side, but that means bilaterally we are using 50. Already in the code description bilateral is there, then why again we need to append with 50? Already code description లో bilateral అని ఉన్నప్పుడు మళ్ళీ ఇంకో 50 modifier ఎందుకు?
ఓకే సార్, అంటే కోడ్ డిస్క్రిప్షన్ లో బయలేటర్ ఉన్నప్పుడు 50 మోడిఫైర్ ఇవ్వకూడదు.
అవసరం లేదు కదా. ఇప్పుడు కిడ్నీ ఉన్నది, కిడ్నీ అనే ప్రొసీజర్ నేమ్ ఉన్నది, అదే కిడ్నీ ఆపోజిట్ సైడ్ కూడా చేస్తున్నాడు అన్నప్పుడు బైలేటరల్ అంటాడు. కోడ్ డిస్క్రిప్షన్ లో నీకు బైలేటరల్ లేకపోయినా కోడ్ డిస్క్రిప్షన్ లో ప్లూరల్ ఫామ్ లో ఉన్నా, అప్పుడు కోడ్ డిస్క్రిప్షన్ లో బైలేటరల్ ఉన్నా, కోడ్ డిస్క్రిప్షన్ లో ప్లూరల్ ఫామ్ అంటే కిడ్నీస్ అని ఉన్నా నువ్వు 50 అవసరం లేదు. కిడ్నీ అంటే సింగులర్, కిడ్నీస్ అంటే మీనింగ్ ఏంటిది? ప్లూరల్. అండర్స్టూడ్? అప్పుడు కూడా 50 మోడిఫై ఇవ్వాల్సిన అవసరం లేదు. ఇక్కడ అవసరం లేదు కదా, ఆల్రెడీ కోడ్ డిస్క్రిప్షన్ లో బైలేటరల్ అనే టర్మ్ ఉన్నది కదా.
ఓకే ఓకే, థాంక్యూ సార్. డౌట్ ఉంది.
కోడ్ డిస్క్రిప్షన్ లో ఇయర్ అని ఉన్నది. ఇయర్, వాట్ ఈస్ ద బాడీ పార్ట్? ఇయర్. నేనేం చెప్తున్నాను, ప్రొసీజర్ లో బోత్ ఇయర్స్ లో పర్ఫార్మ్ చేశాడు అంటున్నాను, కానీ కోడ్ డిస్క్రిప్షన్ ఏమున్నది? ఇయర్ మాత్రమే ఉన్నది. అంటే ఏం ప్రొసీజర్ అది? యూనిలేటరల్ ప్రొసీజర్. అప్పుడు నేనేం క్వశ్చన్ లో ఏం చెప్తున్నాను? బోత్ ద ఇయర్స్ అంటున్నాను. నువ్వేం మోడిఫైర్ ఇస్తావు అప్పుడు?
50 మోడిఫైర్ ఇస్తా.
కోడ్ డిస్క్రిప్షన్ లో ఇయర్స్ అని ఉంది, అప్పుడు 50 మోడిఫైర్ ఇస్తావా?
ఇవ్వను సార్, ఇవ్వను.
ఎందుకు? ప్లూరల్ ఫామ్ లో ఉంది కాబట్టి ఆల్రెడీ. కోడ్ డిస్క్రిప్షన్ లో బైలేటరల్ అనే టర్మ్ ఉన్నది, 50 మోడిఫైర్ ఇస్తావా?
నో నో నో.
అర్థమైందా ఇప్పుడు ఎందుకు ఇవ్వకూడదు?
yes sir. Clear sir, clear. Thank you.
64 Number of muscles we need to count, Geeta Kumari, not trigger point injections. Chronic pain syndrome, right cervical pamus, right levator. Total 2 muscles. 2 muscles comes under A is the answer, Geeta. What is in the key?
Sir, I didn't check in key, sir.
Okay, what is your answer then?
I got A only, but ARC I have doubt, sir.
ARC. Okay, number of muscles here you need to count. How many muscles are there? 2 muscles only, right?
Yes, sir.
Okay, then go by 20552. Question number 60. See, how many stages performed? 2 stages. What is the body part? Forehead. First code for stages, Sunil. Then in first, every stage includes 5 tissue blocks. Every stage includes 5 tissue blocks. But in the second stage, how many tissue blocks they are taking? 6. That means one additional tissue block they took. Then we need to code for each additional tissue block in every stage. Understood, Sunil? First stage, 4 tissue blocks. That means less than 5. No need to code any additional tissue block. Second stage, we need to code for stage, but how many tissue blocks perform? 6. We need to code for that additional tissue block. That's why the answer, I think so, C. Clear the concept? Is the clear, Sunil, for you the concept?
But that is 17312 is first stage, na sir, not for second stage.
17311 is the first stage.
Yeah, first stage.
Every stage includes 5 tissue blocks. In first stage, they took only 4. That means no additional tissue block. In second stage, how many? 6. Already 5 was included in 17312. Which one we need to code? Only 1 tissue block separately.
Yes, sir.
If you read the code description 17315, each additional tissue block after 5 in any stage.
At any stage.
Understood now?
Okay, sir.
For example, I have given 3 stages for you. How many stages? 3 stages. In third stage, I took 7 tissue blocks. That means how many times you need to report 17315?
2 times.
2 times. Now understood? Why? Because each stage includes 5. Greater than 5, we need to code for each tissue block. Clear the concept?
Okay, sir. Okay. Thank you, sir.
Up to 65, any doubts? Up to 65, any doubts? 70. Up to 70. Up to 80, you can drop the numbers, question numbers, up to 80. Drop your question numbers up to 80.
Sir,
Yes.
sir, please explain 68 and 70, sir, by using table vascular families.
Catheter was placed into the abdominal aorta via the right common femoral artery axis. The catheter was used to selectively catheter only the right renal artery. Selective right renal angiography was then performed, demonstrating the go for vascular families. Open your book.
Yes, sir, I am there, sir.
Now 36245, that means lower family, can go with lower family. What is the code description 36251?
selective catheter placement, main renal artery, and any accessory renal artery for renal angiography, including arterial puncture and catheter placement, fluoroscopy, contrast injection, image post-processing, permanent recording of images and radiological supervision interpretation, including pressure gradient measurements when performed, and flush iotogram when performed unilateral. Sir, page number 918.
That family is not under thoracic aorta.
Yes, sir. It's under
Abdominal
abdominal.
aorta. Okay, abdominal aorta. Now, what is the artery there involved? Right common femoral artery axis, right renal artery. ఎక్కడి వరకు వెళ్తుంది? రైట్ రీనల్ ఆర్టరీ వరకు వెళ్తుందా? అవునా కాదా?
Yes, sir.
రైట్ రీనల్ ఏమన్నా ఉందా? చూడు.
Renal అని ఉంది సార్. Renal అని ఉంది. సుపీరియర్ మెసెంట్రిక్ కింద రీనల్ అని ఉంది. ఫస్ట్ బ్లాక్.
సూప్రా రీనల్ అంతేనా? కానీ అది ఏ లెవెల్ వెళ్తుంది? 36246 లో వెళ్తుంది. సెకండ్ ఆర్డర్ వస్తుంది కదా చూడు.
ఎస్ సార్, సెకండ్ ఆర్డర్.
కానీ నీకు 36246 ఏమన్నా ఆప్షన్ ఉందా?
లేదు.
లేదు కదా, అంటే ఇంకా అది వాస్కులర్ ఫ్యామిలీ నుంచి రాలేదు నీకు క్వశ్చన్. అర్థమవుతుందా? అప్పుడు నువ్వు కోడ్ డిస్క్రిప్షన్ చూడు, 36252 నా 253 నా అని. ఇట్స్ అ డైరెక్ట్ కోడ్ డిస్క్రిప్షన్. 252 నా 253 నా. అర్థమవుతుందో వాట్ ఐ యామ్ సేయింగ్?
పేజ్ నెంబర్ సార్, కోడ్ డిస్క్రిప్షన్.
సార్ 251 అయితే సెలెక్టివ్ క్యాథెటర్ ప్లేస్మెంట్
యూనిలేటరల్.
యాక్సెస్ రీనల్ ఆర్టరీ.
But here only unilateral, right?
Unilateral.
Then 251 గాని 253 గాని వస్తుంది.
సో 251 కోడ్ చేసిన సార్ మరి.
$251 is the correct answer. C. 68 C is the correct answer. Everyone C only. Okay. Then another question number. What is your doubt?
70 sir.
70. Now you can see right common artery. Selectively the catheter was diagnosed. RDC catheter was used. Left renal artery was selectively engaged. Then this order is 36246. Yes sir. 245 or 246 sir. Three 7236 in each and every option. Okay. Then 36251. How many of you coded A is the answer? A is the answer. Question number 70. A. Question number 70. A is the answer. Vishnu, what's your answer?
Seventh is B is given, but Mohan key.
I'm checking that radiological guidance can be coded or not.
Sir, I coded C, sir.
No, 37236. See, 37236 itself is saying it includes radiological supervision interpretation.
No need to code then.
During
Then why you
angioplasty.
coded 36251 separately? Renal, it is comes under 36245, right? If you see abdominal aorta to renal, it is coming under 36245. No need to code again separately 36251. Understood here? No need to code again separately 36251. What is the code description of 36251?
Mohan, 36251 is given along with renal, some accessory renal artery is checked. Right, na?
No need to code again this. Why? Because they are coming through right common femoral puncture. It is a selectively catheterized. Catheter was seen, removed, diagnostic. Left renal artery was selectively engaged. Various lesions cross. Pelvic. Only 36245 and 37236 you can put. Okay. It's little bit difficult for you, but don't worry. When you are getting this vascular family question, you can prepare at the end. Those who understood the concept, you can do. Only one question you may get. Understood, everyone? Next,
169.
69 question.
Hmm.
CAVG 2 years ago. 4 vessels, 1 venous, 3 arterial. 3 artery, 1 venous. That means add-on code here definitely It is maybe D is the answer. D is the answer here, Ranu.
Yes, sir. D is answer.
Yes, okay.
Question number B. Geeta Kumari 70B, B for Bombay. 73, someone have asked me. 73. 73 and 76. What is the correct coding when two performs of the esophagus in first portion of barium and contrast in the hospital GI lab? Physician is not an employed by the hospital. You can code here 26 modifier. What is the option? 73. What is the answer I have given for you all? C or B?
C.
Huh?
C for Kolkata.
C is the correct answer, Geeta Kumari. What is your guess regarding 26 modifier? We can code 26 modifier here. Why? Because they're asking to code for physician services. Next 76, the doubt. 76. Here cholecystectomy, incision, gallbladder, cystic duct. There is no laparoscopy here. It's an open treatment. Open treatment. What is the code? Laparoscopic. Cholecystectomy. Sunil Kumar. 76. What's your 47?
562. With cholangiography 47563.
Is there any cholangiography? Is there? Yes or no?
Guided transeptic cholangiography.
Is there, right?
Yes, sir.
47563.
There.
Yeah.
B is the answer.
B for Bombay. Yes.
76 B for Bombay is the answer. Is that clear, Geeta Kumari?
Yes, sir. I have a doubt B or D. That's why I asked.
With cholangiography you can code. Up to 80, any questions from your end? Now 80 to 90. Up to 90. Up to 90. Up to 90. Now 90 to 95. 90 to 95. 90 to 95. 90 to 95. 90
Sir,
to
92.
95.
Sir, 92. 2.
Yes. What's your doubt here?
Sir, here port is inserted, sir, but
Okay.
for pump is coded, sir, here.
What is the code description 36571? What is the code 36571?
Insertion of peripherally inserted central venous access device with subcutaneous port. Age 5 years or older.
Peripherally inserted.
Yes, sir. It is not, sir.
But left
it is wrong.
subclavian, right? Subclavian comes under central inserted or peripherally inserted?
Subclavian centrally, sir. Centrally.
Centrally inserted. But here the code description, are you saying about peripheral, right? 571?
Yes, yes.
Okay, now 566. 566.
Insertion of tunneled centrally inserted central venous access device requiring two catheters via two separate venous access sites with subcutaneous ports.
I don't think so.
సార్ 36563 కానీ 36566 కానీ సార్ ఆన్సర్ కానీ ప్రొసీజర్ లో పోర్ట్ ప్లేస్మెంట్ చేసినట్టు ఉంది
పోర్ట్ అన్న పంప్ అన్న డివైస్ అయ్యి 563 is the answer.
563 కోడ్ డిస్క్రిప్షన్ చూడండి సార్ ఒకసారి ఇన్సర్షన్ ఆఫ్ టనల్ సెంట్రల్ ఇన్సర్టెడ్ సెంట్రల్ వీనస్ యాక్సెస్ డివైస్ విత్ సబ్క్యూటేనియస్ పంప్ అని మెన్షన్ చేశారు అక్కడ
పంప్ అన్న పోర్ట్ అన్న ఒకటే అంటున్నాను
ఓకే సార్
ఓకే 563 can go. What is the option I have given for you? Answer.
563 sir.
563 only. Okay. Next 96 Geeta Kumari. Bilateral lower extremity venous ultrasound. Duplex and color Doppler interrogation. Lower deep vein systems. Augmentation color as well as Doppler. Now 93970.
Without 50 modifier, sir.
Without 50 modifier. Already included, I think, so 50 bilateral.
Yes, already included. Complete bilateral study.
What is your doubt here, Geeta?
Sir, I didn't ask that one.
Sir, in key C is given, sir.
Achha, that's fine.
I think so.
Yes, Geeta, what's your doubt here?
Sir, I didn't ask that one, sir.
96 Geeta. 96 is that one only. Achha, Priyanka. Okay, sorry. Both are started with this G. One is Geeta Kumari, G Priyanka. Yes, Priyanka, doubt enti ikkada?
Sir, only about 50 modifiers.
Already code description lo undi kada Priyanka.
Yes, sir, I coded option D, but key it's given C option.
Okay. In key C is given.
Yes, sir.
Okay, correct. D is up to 100. If completed, text me your scores. Up to 100. See, yesterday I said after updation of the papers, 8 people have written. In that, 5 have cleared their exam. 3 also very narrow margin. Okay, 66, 68 percentage they got. Right? What is the feedback they provided to me is go with the same mock papers, practice as many as possible. That's it. Anatomy, whatever the anatomy questions admin is providing, please go through it. Those are the repeated questions you are getting, billing and anatomy. It will be easy for you to clear your exam. In total paper, any doubts?
messaged you know, I had
Sorry. Question number? Mark 3. Okay.
$90.
Mark 390. See that you can go with unlisted code. Why? Because there is no specific code available for that one. If you go with 64483, that is fluoroscopic guidance. Yes, sir. CT or fluoroscopic guidance. Is that clear? But what is the guidance performed here? Ultrasound guidance. Ruled out option A and B. And go with 0230T. That is the category 3 code.
Okay. So because of ultrasonic guidance, we have to go for 64999. We can't give this 83644 series.
No, that is given only for CT at fluoroscopic. And if you see 0230 below parenthetical note is that do not report again along this with code 76942. That means D option is also wrong. Then what is the remaining option which you see is the answer like that? Okay.
Okay.
How many marks you scored in Mark 4?
Sir, in Mark 4. Sir, in Mark 4, 98. 98, sir.
98 question number you need?
Sir, 98.
98.
Sir,
where is the patient? Inpatient or outpatient?
I have
Patient
doubt, sir,
is
because the
inpatient or
patient is
outpatient?
transferred.
Question number 98, right?
Transferred from nursing. Yes.
The
patient is transferred from the nursing home.
facility. Nursing home. He is saying he's having. Where is the patient then? Hospital admission, right? The patient is in a hospital admission.
Thinking it is inpatient.
It is an hospital admission. You are no need to think. It is a hospital admission. Then inpatient consultation.
In key 99244 is given, sir.
No. D.
In key 99244 is given.
D for Delhi you can take.
D for Delhi.
98, right? D for
Delhi. 99254.
Mohan, for this latest test happened, can't we get the mock papers? I mean, at the latest CPC exam. Question paper.
Come again, pardon?
No, I'm asking, can't we get this mock papers of the latest exam?
That means what they are writing in the examination hall.
Recently, whatever the exam is conducted.
No. See, this is the same replica. They will not allow you to take the paper outside of the examination hall. You need to give your question paper and OMR sheet to the examinee.
No, like these mock papers, I mean, isn't there, I mean, any questions we asked, which we are not aware?
I'm not getting what you are asking, Anupama.
Mohan, I'm asking, like, whatever now, just now test was conducted, na? So what kind of questions were asked and also can't we get these exact
see
questions?
That what I am saying, the admin person will share you whatever the anatomy questions they are asking, okay, from where they are asking. They said in a common way, From the mock papers, each and every concept they tested. You are going to write 7 marks, right, Anupama? That 7 marks, if you revise before going for examination, the same concepts are repeating in the exam. The same. First anatomy, like that. The same paper. But it may slightly change in the concepts of the questions. For example, if you take laceration repair, you are getting here 3 centimeter. In examination, you will get 5 centimeter. Already the admin person shared you in your WhatsApp group. You can check personally. Those are the repeated questions you are getting.
Okay.
They collected information from the people and already shared to you.
Okay. And one more thing, Mohan, this, if this answer sheet can be updated and shared again, because a lot of answers, mismatching, na? So if can be shared, it will be helpful.
Yes. Almost 10 to 12 questions are there. Yeah, he will update and then share to you.
It will be easier to, revise.
Okay.
Yeah. Thank you.
Sir.
Sir,
98 question లో సార్ 98 క్వశ్చన్ లో ఎండిఎం నేను లో కాంప్లెక్సిటీ కోడ్ చేసిన సార్. ఎందుకంటే ప్లాన్ లో లాస్ట్ కు వి విల్ ఫాలో విత్ యూ అని ఉంది కదా, సో నేను 253 కోడ్ చేసిన.
ఒక ప్లాన్ బట్టి వెళ్ళగాకు, కండిషన్స్ బట్టి కూడా వెళ్ళు. ఏమేం కండిషన్స్ ఉన్నాయి?
ఇంప్రెషన్ లో అనీమియా అన్లైక్లీ GI etiology unless some of his future stools become positive. Abdominal pain, prostate cancer.
ఇటియాలజీ క్లియర్ లేదు కదా, అందుకని అది మోడరేట్
అన్లైక్లీ. ఓకే.
Okay, any other doubts?
సార్ అనాటమీ బిల్డింగ్ క్వశ్చన్స్ కోడింగ్ కాన్సెప్ట్స్ కొంచెం మనం ఎక్స్పెక్ట్ చేయొచ్చా సార్?
మీకు అడ్మిన్ పర్సన్ ఇంపార్టెంట్ క్వశ్చన్స్ షేర్ చేస్తారు విష్ణు, అవి చూసుకొని వెళ్ళండి చాలు. ఓకేనా, మాక్సిమం అక్కడి నుంచి రిపీట్ అవుతుంది.
ఓకే సార్.
The admin person will share you some important questions and concepts before going to go for the. Already he is sharing in the groups. Follow the group, Vishnu, or you can ask him.
Okay, sir. I will ask to admin person. Okay, no issue.
This week you are going to write 5th mark.
Yes.
Okay. Priyanka, how is your preparation? Remaining people you can log out.
Yes, sir.
How is your preparation? Are you feeling any panic?
No panic, sir, but still like only in 70, 79.
79 is a good score, Priyanka. Then what? How much you are willing to score? Out of 100 out of 100?
No, sir.
Satisfy at that point. 80. 75 to 80 range, you are keep on constantly maintaining that score. You are scoring good. Your score is very good. Don't worry about the score. Okay? When you are touching 80, 75, 80, please maintain that score. No issues. No need to check for 90, 95. 80 is more than enough here.
Yes, okay. But in mock in 10th question, Z category codes, where do I find?
Okay. Which condition can be listed as primary diagnosis? That question.
Yes, sir. First listed diagnosis code.
That you will get in the index list itself. Go for ICD-10. Open that book.
Yes.
You are having 2021 or 2020?
2021.
2021. Or maybe. Don't waste your time when the examination when you don't know. Skip that question and go for another question. Okay?
Okay, sir.
Don't check for here and there. Don't waste your time.
Mohan, can I interrupt? Then I'll quit. Mock 5 you will be taking on next Sunday.
Yes, yes. Only one mark they're completing. When is your examination?
Mohan, I have selected slot for March.
March only, no? You can go for 6th. Why? Because if I started discussing this week, again next week I want to discuss again 5th mark. 70% of the people are completing only one mark.
Yes, fine. Total 7 only are there, na mock. I have time.
You can go with 6th mark also. Next week I will discuss 5th mark. Can you see here, Priyanka? Section 2, selection of principal diagnosis and rules, G33 page. There can you see Z codes
Yes,
that may
sir.
be only particular first listed diagnosis. In your book
Yes,
also
sir.
you will find it. Okay. There you will see that you will find. Whenever you are having some time, just overlook the book. What are the concepts in the book? Okay, no need to memorize. Just see how the book is organized.
Okay, sir. Sir, in mock 5, so mock 6.
Marks.
Mock 5 only,
Okay,
sir.
she is going to write the examination. That's why I'm answering her questions. Other people you can log out. No issues. Yes, Mark
100
6 you are having
question.
that.
Mock 5, sir.
Mark 5. Mark 5. Which question you are having out? Priyanka?
Last question, sir. 100 question.
100 question. 99. Consultation, refractory anemia. 2
I
days
coded
ago.
as inpatient, sir.
It is an inpatient only.
Key it's given as outpatient. Option B is given.
Okay, then D for Delhi you can take. We will correct the key in the next class. How many marks you scored in this paper?
So 79.
Okay, that's a good mark. See, don't why the voice is very low? Only 79. 79. It's a good mark. Okay.
Okay, sir.
Please practice. When is your exam? 26.
27th, sir.
27. Still one more week is there. Okay. So total,
Yes,
how many
sir.
marks are with you?
2 mocks left, sir. 6 and 7 is there.
You can complete those two and revise. Start revising. Are you able to complete within 4 hours?
Yes, sir.
Okay, that's great. Any other questions, Priyanka, from your end?
సార్ విచ్ అంటే ఏది ఫాస్ట్ గా చేసేస్తే బెటర్ సార్ పేపర్ లో?
ఫస్ట్ ఎనాటమీతోనే స్టార్ట్ చేయ ప్రియాంక. ఇప్పుడు పేపర్ ఎలా ఉందో అలానే ఫాలో అయిపో. ఇప్పుడు పేపర్ 100 to 1 to 100 చేసేస్తే 90 to 100 లాస్ట్ చేసుకో. పేపర్ వైజ్ గా ఫాలో అయిపో. 90 to 100 లాస్ట్ చేసుకో. అది కూడా ఒక క్వశ్చన్ ఒక మార్కే కదా, అందుకని.
Yes, sir.
బిగ్ క్వశ్చన్ అనిపిస్తే వదిలిపెట్టేస్తే నెక్స్ట్ చేసుకోవచ్చు మనం.
Compliance and regulatory.
అది మీకు ఆ క్వశ్చన్స్ ఇస్తాడు ఎగ్జామ్ లో వచ్చాయి, అదేమి టచ్ చేయగలరు. ఓకే
Okay, sir.
సిపిటి ఐసిడి మీద ఎక్కువ ఫోకస్ అయ్యి ప్రియాంక. ఎనాటమీ అను బిల్డింగ్ క్వశ్చన్స్ అవి అశోక్ ఇస్తారు మీకు ఇంపార్టెంట్.
Okay, sir.
That's it.
Sir,
Yes,
in Mark 4 in 96 questions, sir.
Mark 4 question number
96, sir.